Sensory supply of radial nerve including which area? Sensory supply of radial nerve includes posterior arm, forearm, dorsum of the hand and fingertips. Another one is Rolandic artery is associated with which cerebral area? Rolandic artery is associated with primary motor cortex, precentral gyrus. Next one is a woman developed dyspnea, cyanosis, shock, and coma after 1 hour of prolonged labor. Most likely, in pregnant women, there is amniotic embolism because pregnancy and amniotic embolism are associated with one another. Present suddenly postpartum respiratory failure, shock, and DIC. This one is the right answer. The next one is a patient has genitosuprasternal notch dermatome level is C2 to C3. Loss of sensation of the anterior two-thirds of the tongue post-submandibular surgery is due to damage of lingual nerve supplies general sensation to the anterior two-thirds of the tongue. Next one is a muscle supplied by C1 nerve is Glenoid muscle supplied by the fibers via C1 via hypoglossal nerve. These are very important nerve roots to memorize for examination point of view. Dropping of angle of the mouth after submandibular gland excision due to injury of which nerve? Injury of marginal mandibular branch of facial nerve controls and dropping of angle of the mouth. Okay, so the next one is double bubble sign is in Down syndrome includes duodenal atresia. Double bubble sound is a radiological finding in duodenal atresia in Down syndrome patients, which is the cause of cell swelling in hypoxic injury because of sodium potassium pump failure. There is accumulation of intracellular sodium. Influx of the water leads to swelling in the cell. Next one is a chronic smoker with painless hematuria, bleeding in the urine, and then most likely have bladder cancer. If bladder cancer is transitional cell carcinoma, answer is B. Transitional cell carcinoma is present with painless hematuria in smokers. Gray discoloration of the teeth in the children occurs because of tetracycline binds to the calcium developing teeth and permanently gray in yellow discoloration. Tetracycline can cause gray. A 2.5 centimeter tumor at the base of appendix, which is right hemicolectomy, is performed in this tumor, which is greater than 2 centimeter. Right hemicolectomy. And the next question is CT scan shows crescentic shape hematoma in elderly patient. Most likely diagnosis is subdural hematoma because it is crescent. It is bulging vein, especially in alcoholics. Crescent shaped hematoma. Bulging vein rupture results into the crescent shaped hematoma. In children, the femoral head receives blood supply primarily from which artery? That is obturator artery via ligamentum teres in the children. Contributes to the adult and the medial circumflex artery, ligamentum teres. Adductor longus muscle supplied by which nerve? It is obturator nerve. L2 to L4 supplies adductor longus. Next one is which of the following artery is most commonly eroded in the posterior duodenal ulcer? That is gastroduodenal artery. Answer is posterior cell eroding gastroduodenal artery leading to massive bleeding. Mallory Weiss Arboreal syndrome. Main difference is Mallory Weiss syndrome has mucosal tears, hematemesis. Boref syndrome is full thickness rupture, chest pain, mediastinitis, and emergency surgery is required in this condition. All of them are correct. A young female with chronic neck swelling fever likely has Answer is TB lymphadenitis is present in the painless cervical lymphadenopathy. Diagnosis made by FNAC. Phenytoin exposure during pregnancy leads to fetal hydantoin syndrome. It is characterized by craniofacial anomalies, limb defect, and cognitive impairment with teratogenicity. Same like tetracyclines. Okay. Next one is a traumatic patient. Trauma patient has isolated liver injury, failing HB low level. What is the next step if patient is unstable? We will look for blood transfusion after exploratory appendectomy after trauma. White patches on the esophagus in an immunocompromised patient occurs, that is esophageal candidiasis. Because there are white patches, HIV/AIDS patients have common cause of common disease. A known adverse effect of canagliflozin is SLT2 inhibitors. Which of the following antibiotic most associated with the cholestatic jaundice? Cholestatic jaundice antibiotic associated with co-amoxicillin cause cholestatic jaundice in adults. Next one is the diphtheria vaccine work via inactivating exotoxin toxoids. Diphtheria vaccine work in this way.